One of the concerns patients have about breast augmentation is the scar. Endoscopic breast augmentation is a procedure that's designed to address that. Hi, I'm Dr. Peter Lee, board-certified plastic surgeon at Wave Plastic Surgery, a world's leading clinic. Today, we'll be discussing about endoscopic breast augmentation, who are good candidates, what that surgery involves, and what you can expect afterwards. What is an endoscopic breast augmentation? A traditional breast augmentation involves making an incision either underneath the breast itself or making an incision around the areolar region. Endoscopic breast augmentation we can perform in a more hidden way by placing the incision underneath the arm, what we call axillary region, and making a smaller incision there. Because we use the camera to help us visualize, we can perform everything in a more precise and less traumatic fashion. In the past, some people have thought that endoscopic breast augmentation is not really an ideal approach when we're placing a larger breast implants, or if it's a secondary breast augmentation, or if we had to revise the breast for some other reasons, such as capsule contracture. However, now, because we're using the endoscope, using the camera, we can actually perform any of these procedures through an endoscopic axillary approach. What you should expect from start to finish. In the beginning, a very comprehensive consultation is an important component to this type of procedure because there are a lot of different options. There are different types of implants, and specifically also the size of the implants are important. And once that actually is addressed, then we can perform the surgery. The procedure is performed through usually a 3-centimeter incision along the crease of underneath the arm, the axillary region. And because the incision lies within that crease, that scar heals extremely well for majority of patients. And through that incision, we go underneath the muscle, what we call the pec major muscle. In the past, we used to do a breast augmentation through an axillary approach in a more blind, blunt fashion, which means we had a special instrument that we used to place underneath the muscle and kind of bluntly create the pocket for the placement of the implant. But now, because we can put the camera inside, and the resolution of these camera is extremely great. I mean, sometimes it's even better than actually looking at it with your own eyes. We can precisely and without creating a lot of trauma, create a pocket. Once we actually create that space and release the muscle on the bottom, we can place any size implants through an axillary approach. And the final result is we do want more of a teardrop shape, which means at the top, we want more of a gentle slope, and then on the bottom, a little bit more of that rounded form. And we create that by how we actually make the pocket for the implant to be placed. An axillary approach is not a contraindication in terms of how large of an implant that we can actually place, because the axillary skin gives, and it has a very elastic property to it, and therefore, pretty much any size implants we can place through an axillary approach. Typically, the procedure takes about 1 to 1.5 hours. After the procedure, the area will be somewhat swollen, and it usually takes about 2 to 4 weeks for majority of the swelling to go down. In addition, there will be some discomfort and pain. However, with the pain medication that we usually prescribe, most patients tolerate it very well. In terms of activities, most patients, we ask them not to lift anything heavier than 15 pounds for the first month. And then after the first month, they can start going back to their routine, and that includes upper extremity exercises. After surgery, we have the patients wear what we call a compression bra. And this is a bra that we want because we want a little bit of compression to reduce the swelling, and there is no underwire aspect to that bra, so that we want the implant to drop a little bit so that it's more natural. And typically, patients wear that bra for about 1 month. Endoscopic breast augmentation is really ideal for any patients that don't want scar on their breast with a smaller incision that exists underneath the arm. To obtain more information about this procedure, please visit worldsleadingclinics.com.